Hello, my name is Romy Camargo, and I'm sitting here with Dr. John Merritt, future medical supervisor of Stay and Step Spinal Cord Injury Recovery Center. Dr. John Merritt, thank you for coming, appreciate it. Dr. Merritt, can you tell us what the difference between the traditional-based therapy and the activity-based therapy that we will be doing at Stay and Step?
The traditional therapy, as you well know, is therapy that's prescribed after a spinal cord injury. Physical therapy, occupational therapy, sometimes speech therapy, respiratory therapy, that's designed to help stabilize a person medically, to preserve functions, and then to be able to get home to a stable environment. It includes a lot of activities of daily living and mobility training and those kinds of things. The activity-based therapy is I would say, somewhat much more intense. You still have range of motion, you still have electrical stimulation, you still have muscle strength training, balance training, those kinds of things that are part of traditional therapy, but it's based on an intensity that's much greater than the traditional therapy. And even more important, it continues on not for just 6 weeks or so, which is traditional therapy, or maybe 3 months, but it continues on for many months, maybe even years. And in this program, of course, we're emphasizing ongoing therapy at a high level of intensity for many years.
Can you tell us what are some of the other aspects of activity-based therapy?
The basis for having activity-based therapy is to help prevent losses that occur over time with spinal injury. When a person has a spinal cord injury, whether it's in the neck resulting in quadriplegia, or it's in the thoracic spine or lumbar spine causing paraplegia, the body is disassociated from the brain and the upper nervous system after that injury. So you not only have paralysis, which is the most obvious thing, unable to move muscles below that level, but loss of sensation, which is also known, but you also have physiological changes where the muscles tend to change metabolically because they're not continuing to be exercised. So the muscles tend to deteriorate progressively over time. Bones are affected, both from the lack of weight bearing, lack of activity, muscle pulling against those, but also from hormonal changes that occur. And there are changes in the hormonal system, the metabolic system that are affected. Skin is affected, the blood flow is affected, the ability for the body to compensate for changes in posture, to maintain blood pressure, to produce physiological changes in heart rate. All those things are lost and tend to decline unless they continue to have input and stimulation. So the activity-based therapy is designed to help prevent those losses over periods of time, or possibly even to rebuild some of those losses that may have been lost in those initial weeks or initial few months after the acute injury there.
Can you tell us what the goal is for activity-based therapy?
So the activity-based therapy has many different uses and many different goals. And so I would say that in everyone, if medically stable and able to do the ongoing therapy, it certainly will help prevent the decline in muscles and bones and joints and the autonomic nervous system, the skin, and all of those vital functions, respiratory system, and help prevent those declines and help maintain the health of the body below the level of the injury.
Tell us about the body weight supported treadmill system.
The body weight supported treadmill is a way of having the body, the trunk, and the lower limbs, and even the upper limbs to go through the physiological motions of walking with actual weight bearing on a surface. And the weight supported, of course, is that so you don't have to have 4 or 5 therapists holding up the body weight, since the legs are not going to support that. So the body weight holds the person but still allows contact with the treadmill, and then the limbs are moved along in a physiological kind of way. And this stimulates the gait system within what's called the locomotor center, actually within the spinal cord, that actually is independent from the brain, but needs to be retrained.
Tell us about how the military overhead press is also helpful.
Yes, when one looks at the video, one gets the impression that you're lifting this big, heavy weight in a military press kind of thing, like you used to do, but that's maybe a bit an illusion, because in reality, the weight is, your arms are attached to that bar, and it's going up like you're doing the press, but the weight is being lifted by the strap on that. But the fact that the body, the hands and the wrists and the arms and shoulders are moving up and down with that weight gives the same kind of input into the nervous system for that repetitive motion that the body, your legs were doing on the body weight treadmill. So it's a similar kind of training of joint motion, many repetitions, giving proprioceptive input back into the nervous system.
What are the psychological impacts that our therapies will provide?
So I think there's a positive impact on quality of life and psychological stability. I haven't seen studies on it, but I think there's probably less depression, and there certainly is more mobility. People are getting up and going places and doing things, and certainly more active.
What is the goal you see for our program established here at Stay in Step?
My first goal is to do what I can to facilitate its beginning and opening and actually occurring and being here. A facility in Tampa for the hundreds of people who would need this to be available to at least a few at first. I'd like to see the center be successful and do whatever I can do to help it be successful, both by actually being there to help medically monitor, but also to help get the word out in the community and in the medical community, and so that it would expand from just one area here in North Tampa to others in the surrounding regions, and then hopefully that other people would develop similar models in other towns around the country, and that this could be something that could help the greater spinal injury community.
Hey, Dr. Merritt, thank you for coming out and answering the questions, and I appreciate you being a part of Stay in Step Tampa.
Thank you.